Hello friends, very good morning. Welcome back to yet another episode of Manju's Testimony. Today this video is about OET listening, specifically OET listening part B. I will explain all the details about OET listening part B with model question paper. So please watch the video till the end without skipping. And I would like to express my sincere gratitude towards all my viewers, and if you're watching my videos for the first time, please subscribe to my channel and press the bell icon so that you will get all the notifications when I upload the videos. I'm doing OET and basic English related content, specifically OET English. So without wasting our time, let's watch the video.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25. Now read the question.
Okay, your order sheet is in your chart. It's under the tab that's labeled Physician's Orders. You're going to check these orders against your paper MAR. There's 2 pages to your paper MAR, your routine medicines and your PRN medicines. So first check your patient's name, Sally Gunter, Sally Gunter. Okay, then check for the date of birth, 5/8/41, 5/8/41. The next thing you want to look at is allergies. Sally is allergic to penicillin. Your allergy is penicillin. And you want to go down and you want to verify every medicine that they have. So on the orders, it's potassium chloride, 40 milliequivalents, PO 3 times a day. Potassium chloride oral liquid, 40 milliequivalents, PO 3 times a day. K-Flex, 250 milligrams, PO every 6 hours. K-Flex, 250 milligrams, PO every 6 hours. Norvasc, 5 milligrams, PO twice a day. Norvasc, 5 milligrams, PO twice a day. Prilosec, 20 milligrams, PO daily. Prilosec, 20 milligrams, PO daily. When you're looking at your physician's order, make sure it has a date, a time, and a physician's signature. Sally Gunter also has a PRN order of clonidine, 0.1 milligram tablet every 6 hours, PRN for diastolic blood pressure greater than 90. Clonidine, 0.1 milligram tablet, PO every 6 hours, PRN for diastolic blood pressure greater than 90. Now all your routine meds and your PRN meds are checked against your physician's order sheet. The next thing you want to do is to look here. Number 1 is compare your order sheet to your MAR and then your initial once verified. So you would sign your initials that you verify.
So friends, here our question is, you hear a nurse manager instructing a batch on clinical formalities. What is the instructor trying to convey? So from the question, it is very clear that the nurse manager is instructing a batch of nurses about a clinical formalities. So what is the instructor is trying to convey? So we know that this information is about clinical formalities. Then what all are the clinical formalities? That would be the answers. So let's read the options for answers. Standard procedure for medication administration. Option B, methods to improve clinical skill and performance, and option C is checklist prepared for a physician's appointment. So the clinical formalities for which the instructions are given includes either it is a medication administration or skill and performance or a physician's appointment. We just have to find out which among the options is best matching with the clinical formalities which are instructed. Here, when you read the options, just read the options in full sentence at the beginning to understand the meaning of each options. Then you just have to underline the important keywords in the answer options. For example, in option A, I just mark medication administration. Option B, I mark skill and performance. And option C, I mark physician's appointment. So the first part of these options, like for option A, standard procedure, method to improve, checklist prepared, it should be in your mind. Okay, but the important thing that you have to search in the audio is medication administration, skill and performance, and physician appointment. Because while listening to the audio, you don't have to concentrate more on reading the options again and again. You just have to listen what the audio is playing and to extract the correct answer from the audio. So here when you listen to the audio for answers, please don't listen to the audio to just extract the keywords what we have marked here. Okay, I told you to mark the keyword just for you to avoid concentrating more on the options while you are listening to the audio. Okay, so while listening to the audio, please give your full attention and concentration in the audio only, not on the options. We already marked the important keywords. You can just move your eyes on the keywords when you listen to the audio, but your full concentration should be in the audio. But I have to say the keyword should be there in your mind while you listen to the audio, but you don't have to read it again and again. You just have to keep in mind while you listen the audio and repeatedly ask yourself, is it medication administration, is it skill and performance, is it physician appointment. So while listening to the audio, ask yourself what are they talking about? Are they talking about medication administration or skill and performance, or they talk about physician's appointment? For example, in this video, the nurse manager was talking about all the details about medication administration. If you hear the audio again, you could easily understand that it is all about medication administration. She did not say anything about skill and performance or physician's appointment. So it was a very easy question. That's why we easily found out the answer, medication administration. But all the questions are not like this. There may be confusing questions with similar options. So in this case also pay your attention completely to the audio and please read the question and understand the meaning, and the options also please read it carefully, understand the meaning and mark the important keywords. Please keep in mind the keywords without reading the options again and again while your audio is playing. A losing of 1 second attention from the audio will definitely lose your mark. So please keep on listening the audio while it is playing. Okay, that is very very important. So now let's move on to the next question.
Question 26. Now read the question.
So guys, let's read this question before playing the audio. You hear an extract of a nurse talking about confidence in profession. What does the seminar emphasizes? Option A, acknowledge the mistake that was committed. Option B, composed and calm admittance of any errors. Option C, understanding that the situation can be overcome. So, what is the meaning of this question and answer options? Here, a nurse is talking about confidence in profession. A nurse is giving a lecture about confidence in profession. So, our question here is, what does the seminar emphasizes, or what is the main aim or main objective of the seminar? So, let's read the options. Acknowledge the mistake that was committed. So, what is the meaning? Acknowledge the mistake that was committed. So, if a mistake has happened, it should be acknowledged. It should be addressed. I should say that I have done that mistake. So this is what is called acknowledging the mistake. Okay, so the next option is composed and calm admittance of any error. So this means we are not ready, or we just keep quiet about admitting an error. We don't want to tell others, or we don't want to acknowledge ourselves that we have done with an error. So this is what it means. So the next option is understanding that the situation can be overcome. So that means we are understanding that this situation is not permanent. An error happened already, but this situation is not permanent. It will change, or it can be overcome. It won't affect our profession or personal life. This situation is not permanent. It will change. It can be overcome. Okay, so this is what it's mean. So now we understood the meaning of the question and the options. Now we have to just mark the important keywords to keep in mind, not to read in between while listening to the audio, just to keep in mind. Okay, so that we can avoid reading in between listening. So let's see which all are the keywords that we can mark here right now. So I mark the keywords confidence in profession, what the seminar emphasizes, acknowledge the mistake, composed and calm admittance, then the situation can be overcome. So we just keep all these keywords in mind while listening to the audio. Okay. So now let's listen to the audio.
Let's examine this. If I have a fearful thought that I could ultimately lose everything, then it's not going to move me forward. It's not going to help me think clearly. It's not going to help me, move forward and take the actions that I need to take. It can kind of limit me and make me feel like I don't want to do anything because I'm scared to do anything. But what I have found, and this is what I do all the time, is when I'm having a fearful thought, I know that I can't not think about something. Because the more you try to not think about something, the more you're just going to think about it. So you have to replace that thought. And what I replace that thought with is, how can I use this fearful thought or use this fearful event to make me a better person, a better nurse, and to learn from this experience? I'm happy to share this with you so that you can, hopefully learn from my mistakes. So what happened was I realized that I made the mistake, and not only had I made the mistake once, I had actually done it the first time I administered the medication as well. So I thought about it and I was like, okay, well, of course I have to do an incident report. With the mistake, I'm going to show her that I can, not only take care of the situation and have her trust me with her patients, but she can also see that I'm a very confident person and that this mistake won't happen again. So I went to her and I said, I told her the mistake, ultimately told her what happened, and, it was a mistake, and we examined it, and, she asked me a few questions, and it was an uncomfortable situation, but what I realized was that I came out of that as well as I possibly could have. Having the lack of confidence, you can replace that with, no matter what happens, I will build from this and I will learn from this and I will ultimately become a better person. So guys, it's all about replacing those fearful thoughts with thoughts that are going to serve you.
So guys, from this audio we could understand that the nurse talking here, she committed an error. Then after that she went to her manager and talked about what happened. The situation was a bit uncomfortable, but still she managed to talk about the error to the manager. She gained the self-confidence after that. Then she raised the incident report. After that, they tried to find out a solution for the error, so it became an improvement in the practice. Okay, so this is all about the content in that audio. So she was talking that it is all about self-confidence. We have to acknowledge our mistake and tell openly about the mistake to your manager so that you can overcome a frustrating situation. Okay, so this is all about this audio. So from this audio and options we can easily understand that understanding that the situation can be overcome is the right answer, but there may be a doubt can be erased. Why acknowledge the mistake that was committed is not the right answer. Composed and calm admittance of any error, that means we just keep quiet about our error. This is not obviously the answer. So maybe you have a doubt about the option A, but the audio was talking all the things about acknowledging and further actions, right? She acknowledged her mistake, then she talked to the manager take actions, they studied about the error, some improvement happened. So and she told us finally that this is all about self-confidence, and by gaining that self-confidence she got the courage to talk to her manager. So finally she overcome the situation. So this is just not acknowledging. So the audio was talking some more information about what happened after that. So it is all about understanding the situation can be overcome. Hope you guys understood. Let's move on to the next question. So now let's read the question. You hear a doctor talking about Aboriginal mental health. Why did the psychologist say culture born prevention does not exist? Option A, because it is not researched thoroughly yet. Option B is since it has not been exposed to it earlier. And option C is due to the lack of evidence to support it. What all are the keywords that we have to mark here in the question and answers? So let's see the keywords. I'm repeating, keywords are marked not to read it again, just to keep in mind about the answer options. We are marking keyword to avoid reading the answer options while you listen the question. So please don't read any keywords or any answer options while you listen to the audio. Just pay your attention completely to the audio and keep in mind what all are the answer options or keywords in your mind only. Okay, please don't read it again and again. This is to keep in your mind. So the keywords are doctor, aboriginal mental health, why culture born prevention does not exist, not researched thoroughly yet, not been exposed to it earlier, lack of evidence. So now let's listen to the audio. While listening to the audio, just keep in mind that we are looking for the doctors talk about aboriginal mental health. He is saying something about why cultural bond prevention does not exist. So we have to search for it is not researched thoroughly yet, or it's not been exposed to it earlier, or it may be because of lack of evidence. So let's keep all these options in your mind while you listen the audio. Please don't read anything while you listen the audio. Please pay your attention completely to the audio. Okay, so let's listen.
Question 27. Now read the question.
I was actually talking about culture-bound phenomena, and I had a professor of psychology say to me that there's no evidence that culture-bound or cultural illness exists. And I actually said to him, my response to him was that you're absolutely correct. And people were quite surprised when I said you're absolutely correct in the world in which you live. So you actually can't necessarily blame someone if they've never actually been exposed to it before. So the important point is that if you actually don't have it in a framework that most people, and what I'm talking about is mainstream, can relate to, in that it's actually researched and it's written up in a scientific journal, then they're actually forced to relate to it, or at least open their mindset up to a different reality.
So here the doctor was talking to a psychologist who were talking about culture bound prevention. So in that, the psychologist, we have to answer why did the psychologist say culture bound prevention does not exist. So this doctor, the doctor is talking to the who is talking to us is the doctor. Okay, the doctor is talking to us that she had a talk with the psychologist who told there is no evidence to support aboriginal or culture bound illness exists. Our question is why did the psychologist say like that? So now we can easily eliminate option C, due to the lack of evidence to support it. The psychologist says that there was no evidence to support culture bound prevention or culture bound illness. So this is not the reason why he taught like that. So we can easily eliminate option C. Okay, but when the psychologist said there was no evidence to support culture bound prevention or culture bound illness, what the doctor replied, you're right, because it is not written in any journal or scientific research, and the outside world is not exposed to it. So the people who are not exposed to aboriginal health community should be forced to believe that such kind of things exist. So we cannot blame anyone. This is because they don't have exposure to it before, since it has not been exposed to it earlier. So this is the correct option B, since it has not been exposed to it earlier. Why did the psychologist say culture bound prevention does not exist? Because it has not been exposed to it earlier. So this is the right answer. If you have any doubt, just go to the conversation again and see the options. Okay, so now let's move on to 28th question. Let's read it. You hear a pharmacist telling a patient about some medication. Why does she give a verbal explanation of the side effects? Option A, to highlight their severity. Option B, to ensure the patient understands. Option C, to allow the patient to raise any concerns. So let's find out the keywords. Here the keywords are pharmacist telling some medications, why, give verbal explanation, side effects. So the options, their severity, patient understand, raise any concerns. So we have to keep the overall meaning of the question and possible answers in our mind while listening to the audio. So the pharmacist is talking to a patient about a medication side effect. So we have to see why the pharmacist is giving a verbal explanation, to highlight their severity or to ensure the patient understands well or to allow the patient to raise any concerns. So just keep in mind these keywords and you can move your eyes while you listen to the audio, but please don't read, just move your eyes on the keywords but listen and pay attention completely to the audio. So now let's listen to the audio.
Hello, I'm Jan Machescu. I called this morning.
Yes, Mr. Machescu, your prescriptions are right here. They've been ready for an hour.
Good.
Now, take these pills 3 times a day. That's every 8 hours.
I usually take them at 7 in the morning, 3 in the afternoon, and one before I go to bed about 10 or 11 at night.
That's fine.
When do I take the other pills?
You can take these anytime you feel a pain.
Well, it's almost lunchtime. Is it okay if I take one before lunch?
It's better if you wait until after lunch, after you've eaten.
Well, why is that?
The pills may upset your stomach if it's empty.
Oh, okay. I'll wait till after lunch. I'll take one about 1 o'clock this afternoon. Well, thanks very much for your help.
You're welcome.
It is comparatively an easy question. So why did the pharmacist give a verbal explanation to the patient? It is to ensure the patient understands well. It is not to highlight their severity, because we haven't heard about any severity of medication. So she did not mention anything about, or she did not give any explanation about the severity or any side effects of the medications, right? She gave some side effects in between, like stomach upset or gastric irritation, but that is not a severe issue. So we can easily eliminate option A. And what about option C? To allow the patient to raise any concerns. The patient was not that much concerned, or the patient was not that much upset in the conversation. We could easily understand that, right? So the patient came to the pharmacist and asked about for what purpose he was called, and she mentioned everything about the prescriptions. So the patient haven't had any special concerns. Okay, so guys, we almost reached 30 minutes. Now I'm leaving the last 2 questions for you to solve. Please comment below your answers. I will mention the correct answers in the comment section. Okay.
Question 29. Now read the question.
Right, I'd like to tell you about all the patients on this ward, starting with bed 1. John Smith is a 45-year-old male who had a motorbike accident on his way home from work. He was admitted to the ED at 2300 hours on the 1st of August with a frontal lobe contusion.
Sorry, I don't know that word contusion. Could you please explain?
Sure, in this case it means a concussion.
Thank you.
He has breaks in his right arm and hand and has had surgery, including metal plates inserted into his arm. He also has deep grazes on his left knee and ankle and stitches in his right hip and shoulder.
Stitches in the right hip and shoulder?
Yes, that's right. All dressings have been changed this morning at 900 hours. He's on a self-administered morphine drip and he's also on an antibiotic drip. He has had injections to prevent blood clotting and his pain is quite manageable with the medication he's on.
Question 30. Now read the question.
I worked with this man called Graham. That wasn't his real name. He started to hear voices, he had strong paranoid beliefs that people were talking about him. He had to come into hospital, and the main way of actually helping overcome that loneliness and isolation as a result of his experiences was to really enter his world, to develop a shared model, a shared understanding of how these experiences shaped his beliefs and how that made him feel both emotionally and how he reacted behaviourally by avoiding a whole range of situations. It makes me feel really good actually, and it gives me a tremendous source of satisfaction that actually by relating to somebody, by understanding somebody, that you can actually empower them and help them recover. Without the benefits of professional help, Graham would still be stuck at home, he would still be experiencing rather distressing voices.
That is the end of Part B. Now look at Part C.
So guys, that's about today's video. Hope you guys understood what I explained, and thank you so much for watching. Till we meet in the next video. Bye for today.